so the EPA and DHA, for example. So for breakfast, it looks good on paper: vegetable juice, porridge with rice milk, ground almonds. Her lunch was a homemade soup with wheat-free bread, or wheat-free bread with meat, fish and salad. Her dinner, fairly classic dinners, but not a high vegetable intake there, usually less than half a meal and sometimes none. And her snacks are all quite kind of carby and stimulanty. So bananas, dark chocolate, rice cakes, which can play a little bit of havoc with the blood sugar, and needing that pudding in the evening. She was having wheat-free, but she was having it with cream. She was drinking plenty of hot water and nettle tea, which can be quite nice for the kidneys and bladder. The odd bit of ale, but not too much alcohol. Her stomach gets upset within 10 minutes of eating apples, wheat or preservatives. And the apples, that's a common one sometimes where there's bacterial imbalance with the gut because of the high fructose levels. And she'd already started some really good supplements. So we've talked about the vitamin C, the D3 she'd already started. She'd started a high-dose B complex, but noted that it hurt her bladder if she took too much. And high-dose Bs can actually be quite dehydrating and irritating sometimes. So I normally work with the low-dose B, especially where there's lots of dehydration, contraction, and irritation there. She had a general multi and then that calcium carbonate that we've discussed. So what we did was we upped her vegetable intake and reduced carbs to compensate. I gave her some healthier snack options, put in some water elements such as the dooky beans and soups and stews. She avoided the nightshade family, remember that's pro-inflammatory. I got her cooking in coconut oil. She was having warm linseed tea and unsweetened cranberry juice.